Hello guys and welcome to this video. In this video guys, I'm gonna be so glad to share with you guys the uses and a lot of information regarding the medicine of Ticagrelor. Guys, before starting this video, can you just help me with hitting the like button in this video? It's gonna help me to do more videos in the future, and please subscribe into my channel. That will support me and that will make you posted about the new videos I upload. Thank you guys. So, Ticagrelor is an anti-platelet medicine. It makes your blood flow through your veins more easily. This means your blood will be less likely to make a dangerous blood clot. Taking Ticagrelor can help prevent blood clot if you have an increased risk of having them. Your risk is higher if you have unstable angina, had a heart attack. Ticagrelor is only available on prescription. It comes as tablet or melt-in-the-mouth tablets. Key facts. You will usually take Ticagrelor twice a day. Ticagrelor is often prescribed together with low-dose aspirin. The most common side effects of Ticagrelor are getting out of breath and bleeding more easily than normal. You might have nosebleeds, heavier periods, bleeding gums, and bruising. You can drink alcohol with Ticagrelor, but do not drink too much as it can irritate your stomach. You may need to stop taking Ticagrelor for a short time before having surgery or dental treatment, but check with your doctor or dentist first. Who can and cannot take Ticagrelor? Ticagrelor can be taken by adults aged 18 and over. Ticagrelor is not suitable for some people. To make sure this medicine is safe for you, tell your doctor if you have ever had an allergic reaction to Ticagrelor or any other medicine, have any injuries that are currently bleeding a lot, such as a wound, have a stomach ulcer, have breathing difficulties, such as an asthma or chronic obstructive, have an abnormal health rate, have previously had a stroke caused by bleeding in the brain, have got a high level of chemical called uric acid in your body, have liver problems, are trying to get pregnant, already pregnant, or breastfeeding. How and when to take Ticagrelor? Always follow your doctor's instruction when taking Ticagrelor. Dosage. Ticagrelor comes as 90 mg tablets. It's also available as 60 mg tablets for people who need a lower dose. On your first day of treatment, your pharmacist will give you two 90 mg tablets to take at the same time. After this, the usual dose is 90 mg twice a day for 12 months. If you have had a heart attack, your doctor may advise you to keep on taking Ticagrelor after you have finished the 12-month course of treatment. You will usually take a lower dose of 60 mg twice a day for up to 3 years. How and when to take Ticagrelor? When you start taking Ticagrelor, you will take one dose on your first day. After this, most people take Ticagrelor twice a day, usually once in the morning and once in the evening. You can take Ticagrelor with or without food. If you're taking melt-in-the-mouth tablets, put the tablet on your tongue and let it dissolve. You can then swallow it with or without water. What if I forget to take it? If you forget to take Ticagrelor, take it as soon as you remember. If it's really time for your next dose, skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for a forgotten dose. If you often forget dose, it might help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. What if I take too much? Taking 1 or 2 extra tablets is unlikely to harm you, but the amount of Ticagrelor that can lead to overdose is different for everyone. Contact your doctor if you have taken some extra tablets and notice any sign of bleeding. Side effects. Like all medicines, Ticagrelor can cause side effects, although not everyone gets them. Common side effects. These common side effects happen in more than 1 in 100 people. Talk to your doctor or pharmacist if these side effects bother you or you do not go away. bleeding more easily than normal, nosebleeds, bruising or bleeding that takes longer to stop, unexpected shortness of breath while resting. This can sometimes happen in the first few weeks of taking Ticagrelor, and it is usually mild. Pain and swelling in your joints. This can be a sign of gout. This is because Ticagrelor can lead to a high level of uric acid in your blood. Headache, dizziness, feeling sick, or indigestions, diarrhea, constipation, mild rash. How to cope with the side effect of Ticagrelor. What to do about bleeding more easily than normal. Be careful when doing activities that might cause an injury or a cut. Always wear a helmet when cycling. Wear protective clothes when you use sharp objects like scissors, knives, and gardening tools. Use an electric razor instead of wet shaving. And use a soft toothbrush and walk the dental floss to clean your teeth. See a doctor if you're worried about any bleeding. Shortness of breath. Try breathing in slowly through your nose and out through your mouth. Sitting on a chair and leaning your chest slightly forward may help you. Also, your breathing will usually return to normal within a few weeks of starting Ticagrelor. Tell your doctor if your symptoms do not improve or they get worse. Shortness of breath can also be a sign of an ongoing or worsened heart problem. Pain and swelling in your joints. If you get unusual muscle pain, weakness, or tiredness which is not from exercise or hard work, talk to your doctor. You may need a blood test to check what might be causing it. Headache. Make sure you rest and drink plenty of fluids, but do not drink too much alcohol. Ask your pharmacist to recommend a painkiller. If your headache lasts longer than a week or are severe, talk to your doctor. Dizziness. If Ticagrelor makes you feel dizzy when you stand up, try getting up very slowly or stay sitting down until you feel better. If you begin to feel dizzy, lay down so that you do not faint. Then sit until you feel better. Do not drive, cycle, or use any tools or machinery if you feel dizzy. Have muscle cramps or muscle pain or are feeling a bit shaky. Feeling sick or indigestions. Try taking your tablets with a meal or snack or shortly after eating. It may also help if you avoid eating rich or spicy food. If you have indigestion that does not go away, it could be a sign that you have a stomach ulcer. Talk to your doctor as they might prescribe something to protect your stomach or switch to a different medicine. That was a video, guys. Don't forget to hit the like button and subscribe to my channel. That will help me to do more videos in the future, and thank you very much.